Well, it's time now to talk to Dr. Zorba Paster. He's taking your phone calls at 270-608-270-9933. If you have any medical questions for Zorba Paster, call in now. There he is.
Hi, Zorba. Good to see you.
Good to see you guys.
So the mask mandate is ending in Dane County March 1st. What are your thoughts?
I think it's a good idea. I think people are tired of masks, but I think that individual restaurants, individual venues can decide whether or not people should wear masks. Like at the Overture Center right now, you've got to be immunized to go into Overture, and they'll decide whether or not to wear a mask. And it's going to be based on what people want to do. But I think at this point, the death rates are going down. I think Omicron has done a job of basically, taking a lot of people and immunizing them. And we have more people immunized than before. So I think now is the time to actually do it, and it'll be an individual decision. I went shopping today for groceries. I wore a mask. I'm going to still wear a mask.
Yeah, I guess we have to remember sometimes this gets all tied up in politics, but these decisions are really data-driven, and the cases are down.
Right.
Are we near an endemic in this?
I think it's probably going to be here for a long, long time, and it's going to be like influenza. I think that's ultimately what it's going to be. We lived with influenza certainly before the pandemic of 100 years ago, and we're going to be living with this, and maybe we get a yearly immunization for COVID. Only time will tell. We really don't know what the answer is.
All right, we have a call here. Let's go to Patty in Fitchburg. Hi, Patty. What's your question?
Well, my question is, how long does it usually take an F1, L5 fracture to heal of the back?
Well, anything in the back, you automatically assume anything when you break a bone is going to take 6 to 12 weeks, more on the 12-week side than the 6-week side. So if you break your ankle, for instance, you may be able to walk after 6 weeks. It's not fully healed for about 12 weeks. So I would say 3 months and pretty much you're at a good healing plateau.
Okay, great. Thank you so much.
All right,
Appreciate it.
Thanks for the call. And it's nice that people are calling about other things now rather than just coronavirus.
Right. Maybe people are now thinking about other things. And one of the things I think we have to think about is the stress that people have had under the coronavirus. So if you feel like you're mentally stressed, talk to your healthcare provider, look at an antidepressant, look at some counseling. It's a big issue, and that depression and stress is not going away that quickly. It's going to stay here for a while.
And a lot of people put off a lot of medical tests and procedures because of the pandemic, and maybe now it's time to revisit those.
Absolutely, 100%. A lot of people have not gotten breast cancer screening, colon cancer screening, haven't gotten screening for a lot of other things, diabetes and so on. So I think it's important to look at that. And in fact, the CDC has issued exactly some guidance on that, the fact that chronic medical problems have not been addressed that well, and we've got to address them. Otherwise, our society is not going to get back to the health that it was before the coronavirus.
All right, let's go to Roy. Hi, Roy. What's your question?
I would like to know if he heard about a chemical heart attack.
Well, I'm not sure what a chemical heart attack is exactly. I've never heard of that at all. But heart attacks are when one part of your heart actually dies or is under stress and is about to die. And then, of course, we either give medications, sometimes we'll give stents, and quite often people have heart attacks and we just don't get to the hospital in time. But I haven't heard of something called a chemical heart attack.
Do you think maybe he meant the chemical stress test that they sometimes give you?
Oh, that's right. But that's very different. Chemical stress test, instead of getting you on a treadmill and moving around, we actually give medications intravenously that gets the heart stressed, and then we can look and see whether or not you've had a heart attack that we haven't seen under a normal EKG. Stress test will bring out heart disease that actually isn't there, and so it's a very important medical tool that we have for people who we think are at risk.
All right, good catch there, Susan. Let's go to Al in Monroe. Hi, Al. What's your question?
Hi there, say Dr. Zorba. I recently was put on blood thinners and wondered about, I'm a long-time blood donor, and I probably cannot give blood after that, right?
I don't think the Red Cross will want you to give blood because it's going to be in your body. So I think the answer is yes. You're probably not going to be able to do it. You have to check with them, but I don't think they do it when you're on a blood thinner.
All right, I think we have time for one more quick call. Larry from Orfordville. Hi, Larry.
Hi, how are you?
Good. What's your question?
Yeah, when a knee is blown out completely, there is no knee anymore, and they put hardware in there, and like for 5 months you're laid up with a stiff leg. They put in what they call a hinge knee. What's your opinion on that?
Oh, I think artificial knees are incredible. I think they have turned the life for so many people into a better way. It used to be that people walked around commonly with canes. Now people who needed canes years ago don't need canes now because artificial knees are put in. And the real issue is after your knee is put in, you've got to work hard on physical therapy to get that knee to a range of motion that works for you.
Modern medicine. All right, we're out of time. Thank you, Zorba. Thank you all for calling in. We'll do this again soon.
Thank you, Zorba. Great to see you.